Hello, good morning. My name is Geoffrey Chomba Msonda from Zambia. Whilst in Zambia, I'm 58 years old, by the way. Whilst in Zambia, I was diagnosed with some cancer of the skin. We went to our big hospital, the University Teaching Hospital, but instead of following the queue, which is there, my children felt that it was going to be better that they take me to India, to Yashoda hospitals. In the process, as we were still finding our way here, we met Mr. Rohan from Yashoda hospitals, who really encouraged us to say the problem that I had can easily be sorted out at Yashoda. Fortunately, my daughters organized for some money. They bought the air tickets, they did the visas, and we got to Yashoda on the 14th of April 2024. Immediately on the 15th, we were taken to do the tests. And indeed, yes, it proved that I had the cancer of the skin. Quickly, they started making preparations for my surgery. We met the senior surgeon, the Dr. Shrikant, who assured me that the problem I had would be attended to within a very short time. And indeed, I was admitted. Like he said, they carried out surgery on me. Within a very short time, I was admitted for 2 days. I was discharged. It was like magical for me what Dr. Shrikant did to my body. The part that was affected was cut off, and I could not believe it because it was professionally done. I really have to appreciate and say thank you to Dr. Shrikant and his team. It was very nicely done. When I was, after being discharged, I went to my apartment. I kept on coming on appointed days for dressing. I was given a catheter, which was removed after 14 days. Here I am now. I'm all right. I'm okay. I would like to thank Yashoda management. Let them just keep up with the same work attitude. Dr. Shrikant and his people, Dr. Kumar, Dr. Ram, and indeed all the international staff. They are very, very good. I greatly appreciate. And this I will take to my country. I will share it with whoever I bump into that has got a problem. I will encourage them to come to Yashoda. Their attention is very good. It's amongst the best hospitals I've ever been attended to. Before the surgery was done, I had a problem in passing urine and even in walking because I had difficulties. But after the surgery was done, I can walk, I can jump, I am able to pass urine nicely, and the body has come quiet. I've got no pain whatsoever. I'll go home as a very happy person. I came here as a patient. I'm now going out as a truly well person. I've been healed. I can testify.
Hi everyone, I'm Dr. K. Srikanth, Clinical Director and Senior Consultant Surgical Oncologist at Yashoda Hospitals, Somajiguda, Hyderabad, India. So this is regarding our patient who came to us from Zambia with pain in his penile region with bleeding that happens during his intercourse. So I checked him and he was found to have a growth in his penile region which was involving the glands and the corona, and he had some bilateral nodes in his groin. So I got the test done for all these things, and the nodes which are there in the groin were only reactive, that did not get affected with cancer. So primarily his problem was a cancer. We did a biopsy from the growth in his penile region, which came out as squamous cell carcinoma of the penis. It was very foul smelling because he had a tight phimosis. So I had to initially do a sort of circumcision to get access to the growth. So did a circumcision and the same time did a biopsy of that lesion which was there in the corona. Once it came out as cancer, then I had to discuss with him because he was very particular that he wanted to preserve his penis and he wanted to have a micturition or urination in a standing position, and he didn't want to have any issues with his sexual life. Corona, what I meant was his corpora, the muscle part of the penis was partly involved. So, and his penis was not as big as what was suitable for a partial amputation. But since he was very particular that he wanted to preserve his penis, so I got an MRI scan done, and then we found exactly at what level the penile corpora was infiltrated. Then we did assure him that we'll try our best to preserve the penis. I did a partial penectomy, preserving a good stump of his penis. Did a frozen section intraoperatively. We did a most micrographic sort of a surgery where we went very close to the margin. Close means we gave adequate margin of about 1 centimeter or half centimeter to 1 centimeter. From half centimeter onwards, I started dissecting the corpora and sent it for frozen. And the frozen was negative for any infiltration of the tumor. Hence, we did a good ureterostomy, wide ureterostomy, and we preserved the penis post-operatively. And he came to us after 2 months after the post-op, and he was very happy with this urination. The flow of the urinary stream was very good, and as of now, he didn't have any issues with the urination, and we assured him about his sexual this thing also, and he should not have any issues with his sexual issues as well. So after 2 months, we got a ultrasound done for the groins again, and it did not show any cancer in the cancerous nodes in the groin, and his urinary function and uroflowmetry also showed a normal flow of urinary stream, and he was relieved of this ulcer in the penis with pain and foul-smelling discharge. So this was we could preserve the penis in the cancer which was affecting the penis, which many of the times, we have to remove the whole penis depending upon the extent of the cancerous growth. So we could successfully preserve his penis so that he can enjoy his normal life with normal maturation and normal sexual activities. Thank you very much, and it was a very satisfying case, and the patient was very happy because way back in his country, the doctors has advised him complete removal of his penis, and he came all the way to see that penis could be preserved, and we did that same thing with negative margins and a complete surgical curative resection. Thank you very much.